Hello, and thank you for watching my presentation on how to be a rock star direct care doctor. This is a guide to opening your very own DPC practice. I'm Dr. Rebecca Bernard, the owner of Gulf Coast Direct Primary Care in Fort Myers, Florida, which I opened in July of 2016. For more information, please visit my website, bearockstardoctor.com, and feel free to drop me an email at rebeccabernardmd@gmail.com and follow me on Facebook and Twitter. So what is DPC? DPC stands for Direct Primary Care, and it's a new and innovative model of medicine that exchanges primary care health services for a flat monthly membership fee. Now, there are other forms of direct care that don't have to be primary care. Any specialist can also have a direct care practice. The point is that the relationship is between the patient and the physician and is third-party payer-free. In other words, the patient pays the physician directly and the physician provides services. No insurance companies and no government payers. Many people ask what the difference is between DPC and concierge practice, and there are quite a few similarities. The main differences are involving the finances of the practice. Most DPC practices just charge a flat monthly fee and they don't bill insurance at all, whereas concierge practices have a monthly or an annual fee which covers non-covered services like extra phone calls, after-hour visits, emails, and then they usually bill the patient or the insurance for office visits. DPC tends to be much less expensive than concierge care, with the average monthly fee being about $77, while the average concierge practice is about $183. So why DPC? Well, the system is broken, and doctors and patients are really suffering in our current healthcare system. DPC offers an alternative for physicians and for patients to break free of the system and get back to the way that medicine is supposed to be. Doctors are very unhappy right now in the current practice of medicine. Depression rates are high, and physician suicide is at about 400 doctors per year. Almost 50% of all physicians are actively planning to try to get out of clinical practice. Physicians across the board are pretty unhappy, really in every specialty. The happiest physicians are dermatologists, and even they are really not ranking too high here. They're 39% happy at work and 66% happy outside of work, and the numbers just drop from there. Going all the way down, you'll see family medicine doctors 28% happy at work, 59% happy at home, and the most miserable doctors are internal medicine physicians, only 24% happy at work and 53% happy at home. When you ask doctors why they're feeling so miserable and burned out, they'll tell you that it's just too many bureaucratic tasks. They have to spend many hours at work doing unnecessary responsibilities. The increased computerization of practice, and not so much the computerization, but the lack of control of that computerization has affected physicians deeply. Many doctors just feel like a cog in the wheel and like what they're doing is no longer meaningful. And here is a big reason why. This slide shows the growth of physicians and administrators over the last 40 years. You'll see the tiny sliver of brownish red at the bottom is the growth of physicians. The yellow mountain is the growth of healthcare administrators, and the black line is the increase in healthcare spending. Physicians are literally being crushed under the weight and the mountain of bureaucracy. Direct primary care changes that. Like the slide shows in the cartoon, the patient who's trying to be examined by the physician is being blocked by the insurance company. Of course, the patient asks, "Doc, can you see the problem?" And the doctor says, "I'm afraid so." The problem is that the insurance companies and other intermediaries are getting in the way of the physician-patient relationship. Direct primary care changes that completely. There are some huge benefits to physicians to starting a DPC practice. First of all, doctors will experience a much lower patient volume, as the average DPC practice has about 600 patients when it's full. Because we have less patients, that means that we have more time to spend with our patients, and because we're spending more time with patients, we're at much less risk of making mistakes or having a medical error, and less exposure to risk, which in turn lowers our malpractice rates. Physicians no longer have to file insurance, which will decrease significantly their practice overhead as they don't have to employ a lot of staff to just get paid for what they're doing. And importantly, doctors have the opportunity in this model to be their own boss. Patients can also benefit from DPC practices. Most patients in a DPC practice have much better access to their physician and often have access via email and text as well as telephone appointments. They tend to have less wait times for appointments, and often their costs may be less overall, as practices don't charge for office visits or procedures, and many times DPC practices are able to offer patients discounts on lab tests and medications. Patients overall have an enhanced experience. They have short wait times, they have longer time with their doctor when they come in, they usually see the same doctor every time, and their doctor is more focused on them and not on their computer. At the time of this recording, there were about 904 DPC practices open in the United States, and 72% of all practices have only been open for 3 years or less, and that's because this is a new and growing model. You can go to the dpcfrontier.com website and click on the mapper to see what practices are in your area. Who is doing DPC? Mostly family physicians, with 92% of practices being family physician owned, but 19% of practices are owned by internal medicine doctors and 13% by pediatricians. It's about half and half men and women, and most practices are being opened by doctors who've been out in practice for 15 years or more after residency, although a significant minority of practices are opened by doctors that are relatively newer out of a residency program. About half of practices open from scratch, and a third of them have converted from an existing practice into a DPC model. Most DPC practices aim for a target patient panel of about 600 patients. Most practices have not fully achieved their ideal panel size. Only about 17% are full right now, and the average DPC practice has about 345 patients. It takes usually about 20 months for a new DPC practice to achieve a full panel, which is important to keep in mind when you're planning your DPC practice. Here's a look at my patient demographics. I have 725 patients in my practice, and that's between myself and a part-time physician. We have more women patients than men, and that's because we're both women physicians in the practice. About a third of our patients are men and 2/3 are women. We do have a younger working aged population in our area, so the average age of our patients is about 44 years old. 10% of our patients are pediatrics and 12% are seniors. And we do have a significant minority of patients that are Latino Hispanic, and quite a few of those patients are non-English speaking, and that's because I speak Spanish and I do cater to that patient population. Our patient population is unique because the vast majority of our patients do not have health insurance or have a very high deductible health insurance that's not really beneficial to them unless they have a catastrophic problem. This is not typical for every DPC practice, but it is unique to our area, which tends to be more of a blue-collar area. About 12% of our patients have Medicare and 11% of our patients have private insurance. So how do you make a profit in DPC? Well, there's a pretty simple calculation that you can use. Simply take the number of patients that you have in your practice, multiply it by your monthly membership charges, subtract your overhead expense, and that's your income. Or you can do it the opposite way when you ask yourself, how much money would I like to make as a DPC doctor? And then you'll need to figure out how many patients you'll need and what membership charges you'll need to charge, and what you need to keep your overhead at in order to achieve that income. So for example, if you have 600 patients and you charge $60 a month, then your gross income is $360,000. If your overhead is $10,000 a month, then your take-home pay as a physician is $240,000. Of course, if you change any of the variables, number of patients, membership charges, or overhead expense, then you change your salary either up or down accordingly. So let's get to the nitty-gritty of starting a business. And don't be daunted. I know it sounds scary to think about starting your own business, but it's really not rocket science, and people do this every day. You can too. You want to start by creating a name, and you'll want to check to see if that name's already taken just by doing a simple web search. If you've decided that a name looks good to you, then you want to buy up as quickly as you can any related domain sites on GoDaddy or one of those other website buying sites. You also want to claim social media sites that are related to your name as well, like on Facebook or Twitter or Instagram. You'll also need to decide on your business structure. You can be an LLC or an S Corp or even a sole proprietor, but you'll want to talk to your accountant to figure out which makes the most sense from a tax benefit standpoint. You can also consider a DBA, which is a doing business as. So in my case, I already had an S Corp under my name, Rebecca Bernard, MD, PA, and that was for my moonlighting that I did on the side from my regular job. So when I opened my DPC practice, I created a doing business as, so it's Rebecca Bernard, MD, PA, DBA, Gulf Coast DPC. And that just really kept things simpler for me. Once you have your business structure and your name, you'll need to file or register your business with your state. It's usually pretty simple, and every state has a website that helps you do this. And finally, you'll need to get a business license and pay business tax to your county or municipality. Now that you have a name, you'll want to create a logo because you're going to put this on all of your marketing material. For me, I did mine very simply by going onto Facebook and posting that I was looking for a graphic designer to help me make a logo, and through a friend of a friend, I got someone to make my logo for just $50. It could be as easy as that. Or you can go onto one of the many websites that are out there that help you make your own logo or have professional designers actually create logos for you quite affordably. And here's a list of a few different websites that do that, although there are many if you just do a web search. The financial aspects can be a little bit daunting, but again, you can do this. It's not that hard. The first thing you do is you want to go to the bank, whichever one you work with or have an association with, and open a business bank account. You'll definitely need a business credit card, whether you do that through the bank or through an independent credit card company, but you're going to need this when you start ordering supplies and medications. You need to find an accountant. I highly recommend this, and particularly it's important to find someone who really gets the concept of DPC because not everybody is familiar with what we're doing. Your accountant is going to help you with your bookkeeping, but they're also going to help you figure your tax withholding and your payroll. They can help you set up your retirement account, do unemployment tax, and basically keep you out of trouble when it comes to the finances. You'll definitely need to create a budget, and I recommend making this as detailed as you possibly can. You'll do the best job that you can when you start, and you probably won't get it right, but you'll start with some basic numbers and then adapt those as you go through. You need to try to calculate what your overhead is going to be and what your carrying costs are going to be until your practice is profitable. You of course need to have malpractice insurance, and keep in mind that your malpractice will actually get lower when you go into a DPC model because you have a lower patient volume. So make sure that you ask your malpractice representative about that and make sure that you do get a significant decrease in your malpractice amount. You'll also need to obtain workman's comp insurance, and you might want to think about getting business insurance. Next, you need to find your location. It's important to keep it small and just get the amount of space that you really need. Remember that you're going to have a much smaller patient volume, so you might be able to function with only one room or two rooms. You can think about even renting a room or subleasing from another physician. You want to get a short-term lease to begin to make sure that you're happy and comfortable in that environment. And if you have the opportunity to get an executive suite, like I did in a medically zoned building, that can be one of the most affordable options. In my case, I had to move a few miles north from where I really wanted to have my practice because the rent dropped significantly just a few miles further away. So look at all of your options and try to find the most affordable location in your desired area. Really the key to successful DPC practice is keeping your overhead as low as you possibly can within reason. A lot of doctors do this by forming what they call a micro practice, which is usually just one person, maybe just the doctor without even an assistant, and often just one room. It doesn't have to be quite that low overhead, but the lower the overhead often the better, because the quicker you're going to be profitable, and you can always grow from there. It's important to think about asking, what can I get for free or for a reduced cost? Utilize sources like Craigslist to get discounts on furniture and equipment. And remember that you don't need as much staff in a DPC practice because you're going to have a lot more time on your hands. You can do much more yourself. For example, in my practice, I have one assistant, and she does all of the clerical work, and I do pretty much all of the clinical work. I do my own EKGs, I do my own blood draws, I take vitals myself. I never would have dreamed of any of this when I was in a regular practice, but DPC gives me the time to do it, and I really enjoy these elements of practice. You'll definitely need to have an affordable and ideally an easy electronic system for record keeping and for billing, and something that's as automated as possible so that you don't have to have staff. And the more simple you keep things, usually the better off you're going to be. When it comes to staffing, like I talked about, you could go the no staff micro practice office, but more practices usually have at least one staff member, which I do recommend because a lot of times you really need a break and you need someone that can take over, particularly for the tasks that you don't enjoy doing as much. When you have a staff, you want to create an employee handbook so that your staff knows all of their roles and responsibilities. You'll need to think about benefits, which you'll have to think about for yourself as well. As far as health insurance, that's a biggie. In my case, I decided to go with a health sharing ministry. At first I used Medicare, and then I switched it to Liberty. I was able to obtain a plan for myself and my husband, and even buy one for my office manager, and it's still costing me less than a traditional health insurance plan. Either way, you'll need to have some type of coverage for yourself for catastrophes. You'll need to think about retirement benefits, and one of the best advantages to having your own business is that it really frees you up to be able to put more into retirement savings, and you might even create something for your staff member. You'll also need to think about how you're going to handle time off for your staff. Once you have your office, you'll need to set up all of your utilities, your electric, water, internet, and cable. Of course, the phone is very important because that's where much of your business is going to come from phone calls. So you will want to consider your options. And many doctors use voice over internet providers because that lets you transfer the phones to your cell phone and be very portable. Some of the options are Ring Central, Google Voice, 8x8, and Grasshopper, and they each have pros and cons. I highly recommend getting an industrial grade copy machine that does faxing and scanning. That's one of the best investments that I made personally, and it was surprisingly affordable by doing a lease to own. It ended up being about $75 a month. You also want to consider utilizing a shredding company because even if you don't have a huge volume of patients, there is still a lot of paper that's generated in a medical office. So having a shredding company come to pick up your paper and recycle it just makes your life so much easier. Of course, you'll need to set up your office furniture, and the more you can beg, borrow, and virtually steal, like from Craigslist, then the better off you'll be. And you'll need to make a list of all the different office supplies and start to obtain those things. If you go to my website, I'll have a list for you that can get you started. You'll need to figure out how you're going to do your medical record keeping and how to manage your practice as far as billing and keeping track of your finances and your inventory. And fortunately, there are an awful lot of great programs out there. I've listed them here, the ones that I know about, and of course there are new ones that are coming out all the time. There's always the option of using paper, although I think that would be pretty hard to track your financial aspects of the practice. So you may want to consider just going ahead and investing in one of these affordable electronic records that pretty much does it all for you. There are some legal issues to take into consideration. Practices do need to be considering HIPAA, although you may be able to make the argument as a DPC practice that you're not a covered entity. But most practices do choose to err on the side of caution and try to follow HIPAA guidelines as far as having a security assessment in place and a policy and procedure for how you're going to handle any potential confidentiality breaches. To get more information about that, I do recommend Dr. Kimberly Corba's manual of policies and procedures for direct primary care, you can get that directly from her website, and it goes into great detail about how to protect yourself legally. You do need to follow OSHA standards, which is your occupational safety for employees. They do require you to print or obtain a poster that you'll need to put up in your office that shows workplace safety information. And you'll want to have a handbook and some policies about how you protect yourself and your staff members from health hazards in the office. Of course, if you're going to do any point of care testing like strep tests or urinalysis, then you're going to need to get a CLIA license, and there's an application that you do, and you'll need to pay a fee for that to be able to offer that in your office. Now the fun stuff, you get to set up your clinic. You'll need to have all of your medical supplies, everything you need to see patients in the office, an exam table. I got mine from Craigslist, an EKG machine. I show mine here, that's about 40 years old, and I got it from a retiring plastic surgeon, and it's still the best EKG machine I've ever used. You'll need to have all the different medications that you like to have on hand in your office, and of course a refrigerator that's specifically for keeping medications, and any of the CLIA wave tests that you would like to do once you've been approved to do CLIA wave tests in your office. You have to have a waste removal company. This is something that's required from the health department, and you'll set that up with a licensed company that will come and remove your medical waste. They also give you all of the things that you need for sharps containers and red bags, and that way your office is safe and you're in compliance with all the standards. One of the best benefits of DPC is being able to offer our patients discounts on laboratory tests and radiology tests. It's really amazing the way we're able to save our patients money in this setting. And one of the main ways we do this is through setting up something called client billed labs. What you do is you make a contract with a laboratory, and the lab will give you discounts on tests, and you just pay the lab for the tests, and the patient pays you. One of the reasons the lab can do this is because they don't have to chase down 100 different patients to get payment. They just get it directly from you as the doctor. So by doing this client billing, we can often get prices down significantly from what the prices would be if the patient just went to the lab and was self-pay. For example, with my special deal that I get, a CBC costs about $3.50. A comprehensive metabolic panel is $4, a TSH is $4, and so on. You'll need to reach out to the laboratories that are in your area. If they're smaller labs, it may be very easy to get with a representative. If it's a larger lab like a Quest or a LabCorp, you may need to get some help from a group purchasing organization. You can also obtain self-paid discounts from many radiology sites just by reaching out to the representative of the radiology provider in your area and letting them know that you're looking for deals for your self-pay patients. In our case, a large radiology provider gave us all of the every procedure that they do, and the price is just completely transparent. The patient knows how much they're going to pay when they go for an x-ray or a CAT scan, and we can really get those prices down. Like a chest x-ray is $30, a CAT scan of the abdomen is $250. So the prices can be really remarkable and help our patients out. Another great thing about DPC is being able to do in-house dispensing of medications. Now this depends on your state, because there are states that don't allow physicians to dispense. They're working on making some changes to legislation, but you do need to check to see what your state allows. Here in Florida, we are allowed to dispense medications. You just have to get a special dispensing license through the Board of Medicine. And so at our practice, we offer discount pricing on wholesale medications for many of the generic medications that our patients take. You have to follow state law regarding the labeling of medications and how you maintain your inventory, but fortunately, much of the DPC software that's out there does that for you. I use Atlas MD, and it really makes the process very simple to be in compliance with all of the regulations. We usually mark up the price of our medications by about 10 or 15% just to cover our costs of any kind of spillage or expired medicines and for the bottles that we use and labels. But overall, we end up helping the patients save a tremendous amount of money on their medications. Usually we can dispense medicines at even less cost than places like Walmart. We always check, we go to goodrx.com and we check, and if we can get it cheaper, then we order the medicines for our patients. You're going to need to think about what you're going to charge for your membership prices and set your fee schedule. And this is going to be different for every practice depending on your area. Certain parts of the country that are higher socioeconomically may be able to charge higher rates, and they may need to charge more because their overhead is higher or their cost of living is higher. Some of us in more underserved areas or inner city areas may realize that charging higher rates is not going to get the patients in the door, and we need to charge lower amounts. So it really depends on your area. Regardless, you want to keep it simple as much as you can and keep the prices transparent. And we do this just by placing our prices right on our website, and we have it structured by age. We also offer discounts for small businesses. You always want to bill in arrears, which means that your patients are being charged the month after they initiate or receive services. And that's to separate our practices from being termed as insurance. So what do you do if you're not charging the patient their monthly membership until the following month? Well, you can charge a registration fee or an enrollment fee, and that helps you to have income as you're starting your practice, and also make sure that you get paid for those occasional patients that don't pay their bill and disappear after receiving services. When it comes to marketing and advertising, like everything else, I recommend doing it as inexpensively as you possibly can. You absolutely must have a website, but it's super easy to make this yourself, and it can be really affordable. For me, I used Wix.com, and I picked it because it was so easy and because it was only $4 a month. And most websites now have search engine optimizations built into them. Like Wix, for example, has a search engine optimization wizard that helped me to just put the keywords in to the website in the right places so that Google and other web crawlers could find my practice. You'll definitely want to send press releases when you open your practice and look for as much free media exposure as you can. It's super expensive to advertise in newspapers and magazines, so anytime you can get free advertising, that's the way to go. If you have an existing practice, you definitely want to let your patients know where you're going, and if you can tell them sooner than later, that's always great, especially if the job that you're leaving will allow you to tell patients or you don't have a no-compete. You'll want to send letters to your patients if you can. And if you can't, then just make sure that you get your address changed everywhere that you can, especially the Board of Medicine, of course, but also on Google, on all the doctor review sites, on Yelp. You want your patients to be able to find you when you've moved locations. No matter what you do, don't spend a lot of money on advertising. It usually isn't very high yield for this type of practice. Instead, go with free and inexpensive marketing. And one of the best ways to do this is through social media. You definitely need to claim all of your social media pages, Facebook, maybe Twitter, maybe Instagram. You want to create a page for your business and promote that business page by trying to get as many likes as you can. In fact, there are algorithms on Facebook that let you advertise your site and help you to get those likes. And that's usually the first thing you want to do before you start doing advertising or boosted posts. The more people that like your page, the more your boosted posts down the road are going to resonate and get shared. So you want to start by creating your Facebook page, getting content on there, and getting those likes from people in the community. Once you've done that, you can start boosting posts. It's usually very affordable, and you can make a small video, 30 to 60 seconds. People tend to really like to watch those, talking about your practice and what you're doing. You also want to follow different sites on Facebook where people are looking for doctors. Like in my community, there's a group called Southwest Florida, and anytime I see someone asking if does anyone know of a good doctor, then I'm going to go in there and plug myself and put a post of my Facebook page or my website. Sometimes you just have to do boots on the ground and just get out there and make the rounds and talk about what you're doing. Maybe you can get into a Rotary Club meeting, maybe you can talk to a different community group or have an open house, but any way that you're engaging with the community and talking about what you're doing is going to build your practice. You want to refine an elevator pitch, which is just a 15 to 20-second blurb about what you do and why it's so great for your patients and prospective patients. Of course, you want to help patients find you, and you can do that by getting on websites like DPC Frontier, which is free. You just have to ask to be added. And you want to get on any sites where patients are looking for doctors that are doing what we're doing. They're looking for free market doctors. They're looking for doctors that don't deal with insurance. And if you have a special patient niche, for example, if you're particularly interested in integrative medicine or nutrition or transgender care, anything that's special or unique, you want to find those patients and reach out to them and talk about what you're doing and what you're offering. Many practices market to employers, and they're usually looking for those small businesses of less than 50 employees. So in our practice, we have several small businesses that engage with us to take care of their employees. We take care of a few chiropractic offices, a dentist's office, a law firm, an insurance company, and it works very well to help those small businesses. Some DPC practices are taking the approach of looking for the larger employers, but you have to be careful with that because often these employers want data. They want to see that they're saving money, and that means that you're going to have to start doing some of the things that you did when you worked in the system, which is working more for a third party and not as much for your patient directly. If you want to take care of Medicare patients and make a private contract with them, then you'll need to opt out of Medicare formally. And the Association of American Physicians and Surgeons, AAPS, they have on their website some detailed instructions with how to do that. You can't make a private contract or take money from Medicare patients while still being enrolled in the Medicare program, and it's important to know that. In some states also, this is new information for me because I'm in Florida and it hasn't affected me, but in some states there are also some issues with taking care of patients that are on Medicaid. So you'll want to check out DPC Frontier for your state to see if there's any particulars that you'll need to be aware of. Now, while you're growing, remember it's going to take about 20 months before you're full. So how are you going to support yourself in the meantime? If you're an established doctor, well, maybe you have savings that you can dig into, but many doctors will moonlight to supplement their income while they're growing. And that's something that many doctors do. For me, for example, I worked doing weekend work at an inpatient hospice unit to supplement my income, but there are all sorts of moonlighting opportunities that physicians take advantage of. You could also consider applying for a business loan or a line of credit while you grow your practice. Once you're growing, you'll want to consider looking at adding a physician or adding services. In my case, I added a part-time physician, and we decided for her to come in on a percent collections model. So she gets a certain percent of her membership collections, and she has a lot of autonomy in her practice. You can also add ancillary staff. There are practices that have massage therapists or cosmetic elements. In our practice, we have a mental health therapist who comes 1 day a week. Our patients pay $60 per session to see her, and we pay her $50 per patient as a 1099 contract employee. This has been such a benefit for our patients, but also for the physicians, because our patients that are very anxious, depressed, and need more medical services, what they really need is good psychological care. And so working with our therapist has been very beneficial, and I would love to see more practices incorporate psychology. And it's really not that hard to do, and it can be a tremendous benefit. Just a few words about legislation. In the last few years, more and more legislation is coming out for DPC to protect practices, to make sure that we're not being called insurance and being treated as insurance. You can go to the DPC Frontier website to learn more about your state and what is going on there. And also keep in mind that there are a lot of politics surrounding DPC. While most of the DPC doctors you'll talk to are extremely happy with what they're doing and want to tell everyone, there are some detractors. These are some headlines that have been out in the last year or so saying that maybe direct primary care isn't all it's cracked up to be. Now, usually these articles are written by people that are experts in the field of physician management, and a lot of times they'd rather see us do things like what they're recommending, like in this slide. These are some of the proposed solutions that they've given, which is to increase our teamwork, to do more pre-visit planning, to expand the role of non-physicians, and basically more bureaucracy. What they fail to realize is that when we expand the roles of others and we implement this team approach, ultimately the doctor is still responsible for all of that. We can delegate, but we're responsible. So that doesn't really decrease our anxiety or our burnout by following these recommendations. Instead, the option of DPC is something that gives us control and allows us to create our own solutions. That being said, it's not all perfect in the DPC world. There are some downsides to be aware of. First, there is the concept of a 24/7 type of access that may be an expectation for DPC practices. In my practice, although patients can certainly email me or text me at any hour, the chance that I'm going to respond to them at 3 a.m. is pretty much zero. So I don't offer 24/7 access or promote that. I have very, very good access, but I'm not always going to be available, and patients are aware of that. Part of it is just making those expectations clear to patients. And that can be hard, and we need to learn to set boundaries in DPC, and sometimes we want to do everything for everyone, and it can be hard to set those boundaries, and that can lead to us getting burned out even in a DPC setting. It can be uncomfortable for us to talk about money because that's not always something we've ever done before, but the more we do it, the easier it gets, especially as you start to take the emotion out of it. And the other thing that can be challenging is when you have a high patient volume of patients who don't have insurance, sometimes it's hard to get them the best quality of care that you would like for them to receive, and you are often strategizing on different ways to help your patients with limited means, and that can be stressful. But despite that, most DPC doctors are very happy. In fact, 91% of all DPC doctors would recommend the model to other physicians. Compare that to 51% of all doctors who would recommend medicine as a career. The main reason that doctors don't go into DPC or do an alternate practice model is really fear. Doctors are perfectionistic, we have very high expectations of ourselves, and the idea of failing is incredibly scary. We fear failure, but we also fear the unknown. We may fear the guilt of leaving behind patients that have insurance. We may fear the idea of ultimate responsibility. We fear, what if it doesn't work? What if we don't make money? But what about the fear that comes from working in a practice that you're miserable in and day out? What about the fear of burnout? And what about the fear of wanting to leave medicine? So we need to learn to get past this fear. If we're really unhappy in our current practice model, really think about making a change and consider the possibility of something like a direct care practice. Remember that DPC is supported by the mainstream. It's not a fringe type of practice. The AAFP, American Academy of Family Physicians, fully supports DPC model. There are many support groups and many doctors in DPC that are happy to share information for free. Much of the information I've provided for you, I've received for free from the sites that I've already mentioned, but also from people like Dr. Josh Umber at Atlas MD, who provides a free direct care curriculum. There's also a great book by Doug Farrago about starting your own practice. There's a wonderful organization called Docs for Patient Care that puts on free conferences to promote the model. And there's the DPC Alliance that's also promoting direct primary care across the nation. If you're still a little anxious about the idea and not sure, I have some other resources for you that are in my books. The first is the one I wrote before I became a DPC doctor, How to Be a Rockstar Doctor. Talks more about how to manage within a conventional practice world, but also with some information that you can use just in dealing with difficult patients and managing any kind of practice. And then my new book, Physician Wellness, The Rockstar Doctor's Guide, Change Your Thinking, Improve Your Life. I just published that in August, and I co-wrote it with a psychologist. So if you're really want to make a change but you're not quite ready, check out this book, especially the last chapter, which talks all about using psychology to overcome some of those fears and anxieties that we have. There's also a very long appendix in the back with all sorts of resources and help that you can get if you're thinking about starting a direct care practice. And don't be afraid to reach out to me on my website, bearockstardoctor.com, or you can email me, RebeccaBernardMD@gmail.com. I'd be happy to share with you any information that I can. I always welcome doctors to come and shadow me at my practice if you're interested, and there are also many other DPC doctors across the country that would do the same. Thanks so much, and best of luck to you in starting your direct care practice.